और पीछे से उसको गिराओ. There is a large mass seen. It extends from the epigastric region, and wherever my finger is going, the mass is expanding and extending to that region. This is the area of the mass, epigastric region, paraumbilical, then back up to the lumbar region, left lumbar region, and left hypochondrium. This is the area of a solid mass in this 20 years old young boy with no history, no clinical notes, no lab findings, and or any other investigation, for example X-ray, etc. Nothing is provided. So we will start with the subcostal region. Okay, approach, and we see that the liver is not seen below the costal margin. Now this is the liver. You see, this is the. I will first of all clear the liver and the gallbladder, presuming that you know the normal anatomy and the normal ultrasound. This is the gallbladder, normal. This is the portal vein, normal. The liver angle is normal, sharp. Intrahepatic diaphragm, right diaphragm. From here to here, the right diaphragm, smooth outer surface of the liver, homogeneous texture, normal parenchymal echogenicity, the mass is so big, so large. Now this is the middle hepatic vein. The vein is okay. Entering, this is the middle hepatic vein entering the IVC. Comparing with the right kidney. Now this is the right kidney. Okay. Let us see the echogenicity of the kidney with that of, compare the kidney and the liver echogenicity. This is liver echogenicity, this is cortical echogenicity of the right kidney. They are almost equal, so the cortical echogenicity of the kidney is normal. These tiny cystic areas are the pyramids in the medulla, so the corticomedullary differentiation of the right kidney is intact. This is the central sinus echocomplex fat. Echogenic area, again this is the cortex, and these are the pyramids. So the right kidney is normal. What about the upper pole of the right kidney, where the adrenal gland is? The upper pole of the right kidney. This is the upper pole of the right kidney, and in adults it's very difficult. It's not possible to see the adrenal gland, normal adrenal gland, so at least upper pole is clear of any focal lesion, and the lower pole, this is the lower pole of the kidney, and is gliding on the psoas muscle. This is the lower pole. Both poles are clear. So this mass does not appear to relate to the gallbladder, liver, and the right kidney. These three things are normal. These three organs are normal. See the kidney in transverse section. You can see the IVC entering it. Sorry, the right renal vein entering the kidney. Now I am sweeping down. Bowel gases. This is the muscle. This is the psoas muscle, major muscle, this one. These are bowel segments. You will see movement, the change in their position, and internal floating tiny particles in it. These are our bowels. This is the urinary bladder. No ascitic fluid seen. This is the urinary bladder in longitudinal section. This is the prostate. This is the prostatic urethra and seminal vesicles. So right side is doing okay. This is the aorta. This is the right renal. This is the IVC. Then this is the aorta, this one, and this is the right renal artery in transverse section, the tiny cystic area. As you will see, it enters the kidney. Here, yeah, this one. So up to this part, but there is one point that has come in view. What about the IVC? Now this is a midline crossing, huge mass occupying almost all of the left abdomen and expanding towards the right side of the abdomen, in expanding from the midline. This is the mass under study. This is the aorta. This is the aorta. Proximal aorta. And if you note, so this is a midline crossing mass, huge mass, and it is elevating the aorta as well. See the curvature of the IVC, and because below, posterior to it, is the mass, if you see in transverse section. So is the IVC elevated is a question to be answered. It appears to be elevated, but no mass is seen posterior to it. However, pressure, this is the mass. Now the mass comes into view, and you can see that it is not only elevating the IVC, it is elevating the proximal aorta as well. This is the mass. This is the mass in this view. This is the aorta. This is the IVC. and this is the right renal artery, and here you see the mass becomes more clear and is elevating the IVC, midline crossing mass, elevating the proximal part of the IVC. Here you can see that the IVC is elevated. Yeah, here below is the mass, anterior to it is the IVC. This is the inferior vena cava, and this is the portion of the mass. This is the portion of the mass, and this is the IVC, elevated by the mass. Now the mass is crossing the midline, elevating the IVC, raising the suspicion that it may be a retroperitoneal mass. And when we talk of retroperitoneal, now let's see where the pancreas is. Can we see the pancreas? Here we are. Now there is mass effect from the mass, and that is the reason that you may not be getting the organs from the scanning plan that we are used to in routine. Because there is so much pressure of the mass, and the mass is so huge that it obscures your view, especially in case of retroperitoneal organs. Now, this is the pancreas. As because of the pressure from the mass, it is elevated, and we are not getting the vascular anatomy as we should, because of the pressure from this mass over here. Patience is required in pancreatic study. Take a deep breath. बेटा साल है कि साल होगा ज़रा लंबा साल है कि साल होगा I have asked the patient to take a deep breath and hold it if he can. लंबा साह लेके बेटा सर रोकना है, ज़रा बाहर नहीं करना, ठीक है? हाँ, yeah. Here we are. It brings the diaphragm downwards, making easy for the areas to be seen. So this part of the pancreas is normal. This is the pancreatic band. This one. And moreover, this is the pancreas, body of the pancreas. This is the splenic vein. This is the superior mesenteric vein. This is the superior mesenteric artery. This is the aorta. This is the transverse section, aorta, IVC, head of the pancreas. So pancreas is seen and the mass lies posterior to it. बेटा साल है ना मेरा बेटा, जोर दी रोक ले जरा. Again, I have requested the patient to take a deep breath and hold it so that you can see the pancreatic tissue. Now this is the pancreas, and you can see a duct. This is the pancreatic duct. So the pancreas is normal at least at its region of its body. This is its superior mesenteric vein, and the mass is occupying the rest of the abdomen. Where is the spleen? Now this is spleen, and just see from where I am getting this spleen. The spleen has been pushed upwards superiorly into the almost axillary region. I am almost in the axilla to get the spleen. So this is from where I am getting the spleen. This is the spleen. Spleen is normal. This is the left diaphragm, part of the left diaphragm. Its echogenicity is normal, and this is a part of the mass that we are studying. And the area I have encircled, if you note, there are multiple tiny thread-like structures within it. These all structures, tiny thread-like areas interconnecting with each other. Thick and thin. This is a thick one. This is a thin one. This is a thick, wavy, with internal echoes. These fine sand-like particles are the internal echoes. Here there are no echoes. This is black. This is black, no echoes. So, but other segments, compartments do contain echoes. So these are septas, these white lines that you see, thick and thin, X and Y shaped. These are the septas within the cystic area. These are septa within the cystic mass. These are all septa, and you can see float echoes within the cystic area that show fine movements. this is all filled with echoes. This is the septum. These are echoes. This is all fine echoes. This is echo. This is septa. So there are numerous, multiple septations within this cystic area, and the cystic area is very well demarcated. See its outer surface. Okay, we will study it later. Now you see there is another globular area at the posterior margin, at the posterior end of the cystic area under study. This is the area of study. This echogenic area with internal echogenic ball-shaped areas with no shadowing at all. No shadows from any of these ball-shaped structures within the cystic mass. This, I am talking about this one. This structure with, this is a ball-shaped structure, this is a ball-shaped structure, this one, these are all globular, thick, densely echogenic areas with internal, fine internal septa. This is a septa and internal echoes. This area is seen at the posterior margin of the cystic area. The cystic area is this one. So this echogenic area measures approximately 13.5 centimeter into 12 centimeters. And you can see it is anterior to the aorta throughout its length. You can see aorta posterior to the mass. Where is the left kidney? Now see the covering of the cystic area. It is very well demarcated. This is the outer margin. This, let's go to the splenic area, and then now this is the outer margin. So it has a hypoechoic thin wall around it. This, it measures 6.2 millimeters. So 6.2 millimeters thick band, hypoechoic area around its capsule. This line is the capsule of the large cystic mass. This is the spleen. Is pushed superiorly up to the, and laterally as well, by this well demarcated huge mass seen up to the right iliac fossa. Now this is where I am at present. So you see, I can see the mass extending from the axillary region where we saw the spleen. Then you see all this mass coming up to the suprapubic region only. Rather, it does come to the suprapubic region, but up to the, you can see it up to the left lower abdominal quadrant. Here, see that with well demarcated outer margin. This one, this line echoes low level fine, echoes septas. And from here now I am at the just anterior to, just above the suprapubic region, angling the procapsuloid towards the patient's head region, and this is the total cystic area that can be seen in one view. It cannot be seen in total. It's such a big mass, it cannot be seen in total in any one view. As for example, this is an epigastric view. From the epigastric, I have moved the probe posteriorly towards the legs of the patient. So get this one. I am below the costal margin. You can see it at the right costal margin. This is the left costal margin. So it is seen on both costal margins, but the thing is that in scanning all these areas, left kidney is not visualized. Maybe this is a long. He gives a long history of 2-3 years for this mass, and there is possibility that by the pressure effect of this large mass, the kidney stays here. The spleen has been pushed up, and possibly by this mass, the kidney has been destroyed. If this mass had been a renal mass, then two things would be very unusual for it to be a renal mass. One, there are no claw-shaped areas seen as we see in massive hydronephrosis, and secondly, it crosses the midline. Thirdly, it elevates the IVC. So by ultrasound parameters, what can we say about this mass is that there is a huge mass seen extending from the from the epigastric region to the suprapubic region, expanding on both sides of the midline. It crosses the midline, and more on the left side than on the right side. It elevates the IVC, and aorta is seen posterior to it, with spleen displaced by the pressure of this mass superiorlaterally. Left kidney is not seen, and the appearance of the mass is well demarcated. It's a huge mass. We cannot see it or measure it in one plane. It has a well demarcated outer surface, a rim. Again, you can see the right side. Left we saw, this is the left. So it is pushing the liver upwards as well. And the appearance is that it is full of low-level echoes with full of internal septations, both thick and thin, complete and incomplete, and there is a large area in the dependent region of this mass, which gives an iceberg appearance. Multiple echogenic, non-shadowing, ball-shaped structures seen attached together by strings of, these are the strings of septa within them. So the most probable diagnosis is that this is a retroperitoneal mass. Now no calcification is seen in it. We didn't see any calcification. So this is a huge retroperitoneal mass crossing the midline, elevating the